We need healthy lungs to breathe, and it's increasingly being recognised that early life exposures affect whether you grow healthy lungs. In Africa, pregnant women and small children are exposed to many hours of high levels of smoke every day, and this is having life-changing and life-limiting effects on huge numbers of children. Dr. Rupert Jones, a lung health expert at Plymouth University's Medical School, explains the situation in many villages across Africa.
So when you go to the villages and you see the cooking areas, these are very small spaces. They may be 6 foot square or even smaller. They've got brick walls, they've got a tiny window, they've got a door which is normally sealed off, and there's a fire. And that is throwing out a lot of smoke. And if you go in there, your eyes will be streaming, and you think about what it's like to be cooking in there every day. And we know the women are exposed for 7 hours a day, and they're in there with their children because someone's got to look after the baby. And if the baby's strapped to the back, they are exposed to a massive level of smoke exposure and for a huge period of time. And sometimes these fires are tended to by small children as young as 4. That means they get high exposures for huge periods of time, just in that critical time when their lungs are growing.
As a consultant paediatrician working in Uganda, Dr. Rebecca Nantanda sees many cases where exposure to biomass smoke is severely damaging the health of pregnant women and their children.
When a pregnant woman is exposed to smoke, there are different things that can happen to that pregnancy. Sometimes you may have them bleeding, what medically we call antepartum hemorrhage, bleeding during pregnancy. Sometimes they may end up having a baby born too soon, which we also refer to as premature births. And sometimes they have an increased risk of getting what we call preeclampsia, but literally we call it having high blood pressure during pregnancy. And all those, consequently, you have the mother being at risk of dying because of, for example, the bleeding, the preeclampsia, but also when you have a premature baby, then you have the risks of the premature baby occurring, like difficulties in breathing, the high risk of infections. So all those are consequences to the pregnant mother. Now, when it comes to the babies, remember the baby is young, their lungs are still growing. So if these lungs are exposed to smoke or from cooking, for example, then it causes damage to the growing lungs. And then they can have repeated infections every time, and now the child is coughing, the child is having pneumonia, they are going to the hospital every time and then. And as they grow, they also have an increased risk of having asthma. When they're older, they have an increased risk of getting chronic pulmonary obstructive disease, which we refer to as COPD. And of course, we know that when people are exposed to smoke, then their risk of actually getting TB disease is also high.
This is a huge scale problem in Africa. Most people are exposed to biomass smoke throughout their life. In our earlier studies, we showed that 1 in 8 adults were suffering from chronic lung disease. Even as young as 30, they had signs of this disease. Later in life, they get respiratory symptoms such as cough and breathlessness. These progress so they become disabled. Life becomes very hard for them, and it can be a life-shortening illness. It increases the risk of death prematurely. And sadly, there's very little awareness of this problem in the community. That includes the health services in the community and the people living in the community. They don't know that this is a problem, and they don't know how to deal with it. And yet the steps to deal with it are really quite simple. Once we discovered the scale of the problem, we couldn't stand idly by. People, through lack of awareness and lack of simple measures, are dying or becoming very disabled, and this is a completely preventable problem.
With a strong foundation of research, Dr. Rupert Jones and his team at Plymouth University worked alongside specialists at the Makerere Lung Institute in Kampala, Uganda, to create an education programme which could ultimately prevent many people from suffering serious lung health issues.
This project was started 3 years ago. It was funded by the Horizon 2020 programme of the European Union, and this project is part of a wider program of research, which is looking at chronic lung disease. How does it occur in the different settings? How can we identify and diagnose people? How can we manage them in terms of smoking cessation? How can we manage them in terms of biomass smoke exposure? How can we treat them with pulmonary rehabilitation and other innovative methods? It also includes work in children, particularly around asthma. So the way this works is that we take our existing research, which shows that we can reduce exposures and we can prevent problems, and we put that into practical implementation in Uganda. We develop materials with the midwives and the health service locally, such as flip charts, such as posters, such as booklets. We make the whole community aware of the problem. We then do the teaching of the midwives, and we have packages of education materials for them. We then assess how they deliver that in the community. Throughout this whole program, there's a rigorous assessment so we can see that this is working.
On a visit to Uganda, members of the Plymouth University project team were able to see how their work was being put into practice. Here, medical scientist Dr. Sanna van Kampen reflects on the response to the programme.
So far, what I really enjoyed is seeing the education material and everything we developed being used in the field. It was really amazing to see how the material was presented by the midwives, how the mothers were there to listen, and how enthusiastic everyone was. They were discussing every picture, every message. And I think what we got back from the midwives afterwards is that the mothers really learned a lot. The engagement and interaction was really incredible.
So we were able to teach them about the stoves that they use, the fuel they use, that the cooking areas are sealed in, and that they need at least 2 windows, they need good ventilation, you need space under the roofs so that air can get out, and all of those things are simple measures, and yet that can help the smoke come out, and that prevents a lot of problems for the mothers and the small babies.
I hope this project will achieve a change in behavior for the better in the local communities in Uganda, starting with Jinja district, and hopefully in the future it can be expanded to the rest of the country and beyond.
This project addresses a huge problem using simple tools and technologies, and as a result we can prevent people getting serious disability and dying. And we expect this to be used not just in Africa but in Asia and other places where smoke exposure is a big problem.